armed conflicts, natural disasters, medical emergencies. In 2008, Médecins Sans Frontières has worked on all these crises and frequently in increasingly difficult contexts. In North-Kivu in eastern Congo, intense fighting resumed at the end of August, causing the displacement of hundreds of thousands of civilians. MSF has been working in the region for a long time, bringing precious aid to the population and treating all war wounded. Its neutrality has enabled MSF to continue its activities even at the peak of violence, for example, in Rutshuru.
We wait for the wounded, and when they arrive, we treat them.
We treat everyone at this hospital, everyone, without exception. There are a lot of armed groups here, and they all know that as soon as they're injured, they can come here. And so it's in everyone's interests to keep the hospital safe.
Elsewhere, this message is failing to get through. In many countries, such as in Iraq, Pakistan, Chad, and in the Darfur region, insecurity is hindering humanitarian aid. In Somalia, direct attacks and threats forced MSF to withdraw all international staff from its programs in May 2008. Aid is currently reaching the population thanks to our Somali teams.
We think we know the situation, but still, hundreds of thousands of people are caught in the crossfire in the capital Mogadishu, and hundreds of people that have fled the capital are still totally relying on external aid. It looks like if the international community had given up about Somalia, but we can't. We can't.
However, insecurity is not the only obstacle to delivering assistance to populations in need. In certain countries, humanitarian aid is perceived by the authorities as a political threat, and our presence is barely tolerated.
In countries governed by authoritarian regimes, humanitarian action has been hindered or even prevented. Take Myanmar, China and Zimbabwe, for example. These are three countries in which it is particularly difficult to intervene, especially in acute crises.
Another obstacle faced by our teams in 2008 has been the lack of international mobilization with regards to major public health issues. Despite the fact that malnutrition kills between 2 and 5 million children every year, and that effective products to treat these children exist, international aid remains nutritionally inappropriate.
We feel the governments of the countries affected by childhood malnutrition are totally ignoring that situation. And we have made tremendous progresses. We are now able to treat with ready-to-use food containing all nutrients, vitamins, energy that are needed for treating these children. We know how to do that. This has now to happen. We can treat millions of children if the governments, if the international donors want to make that effort. We have to do that now.
Treatment for tuberculosis is another neglected health issue, particularly for patients co-infected with HIV. There is also the worrying increase in drug-resistant forms of tuberculosis, for which again, international mobilization calling for new drugs and new diagnostic tools is drastically insufficient. In 2008, Médecins Sans Frontières ran 78 projects in 30 countries, investing a total budget of nearly €125 million.